Isolation speaks more to persons who display symptoms, flu-like symptoms, and are therefore placed in a hospital setting under hospital supervision to treat with those symptoms, but at the same time to validate or rule out any possibility of them having the virus.
It's very important that we pick up these symptoms early so that we can isolate these patients. Under isolation conditions now, if this person continues to develop symptoms, then this person would be separated from other persons who they could pass the virus onto, and they will be nursed in a controlled situation to prevent any spread, either to other members of the public or to healthcare professionals.
Government, utilizing the available powers under the laws of Jamaica, instituted protocols for immediate isolation of persons entering the island exhibiting flu-like symptoms.
In terms of moving a patient to isolation, if they have come from an area of concern and they had any symptoms at when they landed, we would have moved them into isolation. That is our protocol. And the symptoms, when we had put any symptoms, is out of an abundance of precaution.
On the grounds at the community level, where persons may have returned from countries with the virus and may have made contact with the wider community, quarantine and monitoring at home for symptoms will take place, and where symptoms are exhibited, they are isolated and testing is done. Isolation serves the same purpose as quarantine in that it keeps infected people away from those who are healthy to prevent the virus from spreading. However, it is reserved for those who are already sick and provides for treatment and recovery, usually in a hospital setting. When you are placed in isolation, the following is done.
We test persons who are ill that fit a particular, what we call a case definition. So you have to have all the criteria that is required for testing. If you meet that, then you are tested. And the test is done at the National Influenza Center. It's what we call a respiratory sample. So the mucus that we would get from the lining is what is taken and then sent to the National Influenza Center, and it's what it called a PCR test is done on it.
In isolation, what we have now is definitely a more restricted conditions. So we would have a room that is essentially sealed off from the rest of the hospital facility or whatever facility it is in. Okay, persons who enter into that bubble have to be completely protected. Okay, so they protect themselves by wearing mask. They may wear a cap to cover the hair. They may wear face shield. They may wear gowns. It all depends on what kind of symptoms the person is having. For example, if you have somebody that is coughing a lot and there's a lot of droplets, then you are going to take more precautions. Okay, so the persons that are entering into that room to interact with the patient have to make sure that they're fully protected. So they usually don those personal protective equipment on going in, and then on coming out, they remove all of those things and discard them. There are certain conditions under which we may isolate persons together. For example, if they're close family members and both are suspected to be infected and have the same kind of course together, so we may choose to isolate persons like that together. But for the most part, we will separate persons.
Isolation facilities have been set up in all hospitals across the island. Home isolation is possible only where persons with COVID-19 are well enough to receive care at home and there is an appropriate caregiver, a self-contained bedroom and bathroom where the patient can recover without sharing an immediate space with others, and there is access to personal protective gear. Regular cleaning, sanitizing, and disinfecting of all areas of the home, including high-touch areas, should be done daily.